Patients will often return to the same general practitioner as they develop a relationship with them. Then the doctor will be aware of their history and family circumstances and can use this information during any consultation.
Hello, Mrs. Thomas. It's good to see you again. How are you feeling?
I'm fine. I'm so glad I got to see you again, Doctor. As you know, it's been 5 weeks since my operation and I feel ready to go back to work. I just want everything to get back to normal again. My manager said I should come and talk to you.
Right, well that is certainly something we can talk about, Mrs. Thomas. It's a university you work at, isn't it?
Yes, behind the reception desk. It's a full-time job and they've been really good about me having this time off, but I'm worried about sick pay.
Right, and what does your job involve exactly?
Well, I spend most of my time at the computer and dealing with questions from the students.
And how do you think you would cope with going back to work there?
Well, I'm looking forward to going back and my sick pay will run out soon. But I'm a little bit worried I might be too tired to do the job properly. I have to travel in on the tube and that worries me too because it's often crowded at that time of the morning.
Well, I can completely understand those concerns. Have you talked to your manager about this?
Yes. When I met with him, he suggested you might be able to write me a note so that I could have a phased return to work, which would ease me back into it.
Well, that's not a problem. We can give you something called a Med 3 on which we can specify the best way to phase your return. Could you manage with, say, 2 days a week to start with? Perhaps you could have late start, early finish to avoid the busy tube?
Yes, I think that would be really helpful, Doctor. I like your idea of the late start because I'm not sleeping too well at the moment.
Right, okay. Do you want to tell me a bit more about your sleep?
Well, getting to sleep is always a struggle. As soon as I lie down, my mind is full of worries. Then when I do get to sleep, I wake up in the middle of the night and I just start worrying again.
Right. Well, I'm sorry to hear that. And what are these worries which are waking you up?
I'm always worrying about the cancer. What if it's come back? What if I don't realise it's come back? And all my worrying is taking a toll on my family who keep saying to me, pull yourself together, the cancer has gone. I know it sounds silly, Doctor. I know it's gone. But I just can't get these thoughts out of my head. It's getting me down.
Well, I'm very glad that you've told me how you're feeling. Mrs. Thomas, you've been through quite a lot. And I can completely understand why you're worrying. Do you have a good set of friends you can speak to?
Yeah. There's my son. And my friends have been great. They really rallied around. But they're all busy.
And how have you found the support from the Macmillan nurses team and the cancer centre?
Well, they've been okay. I told them I was feeling okay, to be honest.
Well, do you want me to give them a ring? To talk to them about how they could help you in this situation? The cancer centre do offer some psychological therapies actually. That might be useful in helping you to deal with your worries and your thoughts.
Yes, Doctor, I think that would be good.
Okay. And you mentioned sick pay running out,
Yes.
needing to go back to work. We do actually have a volunteer-run service here at the practice on a Wednesday. Now, they could help you with claiming benefits and helping you to fill out all the forms.
But I'd really like to see them. I've never had to claim any benefits before and I wouldn't even know where to start. That's part of the reason why I'm rushing back to work.
Okay, well, I could make you an appointment with them next week.
Right.
Now, I'd just like to ask you a few specific questions, if that's okay. Have you lost any weight recently or had a change in appetite?
I'm doing okay actually, Doctor. I force myself to eat.
Okay. And do you still enjoy doing the things that you used to enjoy?
Yes, actually. I'm planning on going back to my Zumba class. I really enjoyed it and I miss my friends from there.
Okay, well that's great. And Mrs. Thomas, you have been through such a lot and you're having some trouble sleeping, which doesn't help. Some people, when they're feeling low, they can feel like ending it all. Have you had any thoughts like that at all?
No, Doctor. I've got too much to live for. There's my son.
Okay. So, I am going to contact the Macmillan Nurses team,
Right.
the counsellor and psychologist at the cancer centre to get you some talking therapy.
Mm-hmm.
I will also make you an appointment with our volunteer run service. Now, I know you came here to discuss returning to work,
Yeah.
but do you think it might be useful if we meet again in a couple of weeks' time, just see how things are going? Because there are other ways that we could work together to lift your mood, maybe tablets, and then we can see how you're doing and whether you feel ready for a phased return.
Yes, Doctor. Shall I book another appointment at reception?
Yes.
And can you still sign me off sick until then?
Yes, I can. So, here is a Med 3 for the next 2 weeks. So, you can give this to work to tell them that you're not quite fit to return just yet.
Right.
And also, if you make an appointment with your work's occupational health team, just to keep them in the loop.
Mm.
And in the meantime, if you have any worries, any concerns, you feel low or suicidal, please do come back and see me. Or you can call 111 if the practice is closed, okay?
Yes, thank you.
Okay. Take care, Mrs. Thomas. I'll see you again soon.
Bye, Doctor.
Bye-bye.
It's really good to have got that sorted. It's nice to know Dr. Kowalski can support me even with things to do with work. It's lovely to know that she has my best interests at heart.
Mrs. Thomas needs to see a general practitioner as she is struggling to manage her pain. This scene is set in the reception area of a GP practice, and Jack is calling for an appointment to see Dr. Kowalski with his mum. The receptionist is often the first person that the patient and their family speak to in order to gain access to a doctor. They often get to know the patients and their families well and can pick up concerns on the phone. They are trained to deal with complex situations and direct the patient to the right healthcare professional.
Lambton Road Medical Practice, how can I help?
Hello, could I make an appointment for my mother to see Dr. Kowalski, please?
Yes, of course. And would she be happy with a routine appointment in 2 weeks, or would she like to see a doctor urgently?
Well, my mother had a mastectomy 5 years ago and is now really ill, and we're struggling to keep her pain under control. My mother is Mrs. Thomas, and she's been awake most of the night. It's really terrible.
Yes, Mrs. Thomas, of course. She usually sees Dr. Kowalski, doesn't she?
Yes, please.
Perhaps a double appointment might be an idea for your mum. We can sort one out for you. I'll just need to do a bit of juggling around, so I'll give you a call back if that's okay.
Okay.
Can I take your number and I'll give you a call back in about 15 minutes?
Sure. That was so great that the receptionist realised who my mum was and was able to try and give her a double appointment. That was really nice.
As a receptionist, it's really nice to be able to recognise patients and their family relatives over the phone. For instance, with Jack, I was able to book him a double appointment as I was aware that he sounded worried over the phone.
It's now 4 years since Mrs. Thomas had her mastectomy. She's been recently diagnosed with secondary deposits in her chest wall and ribs. She had a course of radiotherapy that gave her some relief, and 2 days ago she was told that there are no further treatment options. She has come to the surgery with her son, Jack, and is struggling to manage the pain. Part of a GP's role is to prepare Mrs. Thomas and her family for the end of her life, and to talk about some decisions and plans they can take.
Hello, Mrs. Thomas and Jack. It's lovely to see you. How are you keeping?
Doctor, the pain is becoming unbearable. Last night, I was awake most of the night, disturbing Jack, who's staying with me for a while. I've been struggling to do much in the daytime too. Jack's been trying to go to work, which is good, but he's been worrying about leaving me as well. I don't want it to be like this. Is there anything else you can give me?
I'm so sorry to hear that you're suffering. Let's have a look at your medication. We'll see if there's anything we can change or add.
Thank you. Thank you, Doctor. I'll try those patches. Maybe they'll help.
Yes, and we do have a team actually who can help with the pain, as well as other aspects related to the cancer. They can help to guide you through this part of your journey. Have you heard of them? They're called the Palliative Care Team.
Yes, I've heard of them. Are they based at our local hospice?
Yes, they are, but you know they'll be very happy to come and see you at home or to arrange an appointment. Have you been to the hospice before?
Yes, my brother-in-law died there a few years ago. That's how I know about them. Last night, when it got really bad, Jack and I talked about the future. Now everything seems to be taking a turn for the worse.
Well, I'm very glad that you have started to talk about all this. Was there anything that you spoke about which is important to you at the end of life?
Yes, we have been talking. But Jack gets very upset when I talk about my last days. I'm sorry, Jack, but we have to talk about it. Dr. Kowalski knows me well. I've been reading up about it all, and I want to be comfortable when I die, not in pain, and not in a hospital. I hated being there for my operation. I couldn't sleep, and everything's so clinical, isn't it? I'm not sure whether the hospice would be the right place for us, or should I stay at home?
Well, that is something we can talk about more. And the palliative care team will be very happy to discuss the options with you. You know, they will be great at providing support for you and Jack during end of life and even after death. Now, I know you just mentioned having a comfortable death.
Yeah.
I know this is a difficult thought, but has anybody spoken to you about what you would like us to do if your heart stops?
No, they haven't actually. Would I have a choice in the matter?
Yes, of course. There is something called a do not resuscitate order. Now, what that would mean is if your heart stopped, we would let you slip away and we wouldn't perform the chest compressions. The alternative would be that we press on your chest, we breathe into you, possibly shock you to try to restart your heart.
No, I wouldn't want that.
Would it work if this happened?
Well, I can't say that it wouldn't work, but with patients like your mum who has a terminal illness and whose heart stops, it would normally stop again shortly afterwards. And if we do restart your heart, it doesn't necessarily mean that you regain consciousness. So there is something called do not resuscitate order, which I can put on the notes. You keep a copy at home, and I upload to our system here called Coordinate My Care. And then the paramedics or other health professionals can see it, if something should happen and if I'm not around to ask.
That sounds like a good idea. But it's a big decision. Can Jack and I talk about it later?
Of course, yes. And maybe we can talk about it again next week. Now, Jack, you look quite tired. How are you coping with everything?
Well, like my mum said, I'm working on and off and working from home. I do whatever I need to.
Mm-hmm. Well, I'm very glad that your mum has your help and support. And you know, the palliative care team could take some of that load off you. Perhaps a carer is something that you might be interested in?
I've been telling him we might need one. I don't want to be a burden. The Macmillan nurses are coming around tomorrow afternoon, and they mentioned something about referral to social services for a carer assessment. Is that through the palliative care team?
Yes, it is, but don't worry about that, because I can refer you today.
Oh, thank you.
So, what we're going to do, we're going to start you on those patches for the pain. I'm going to contact the Macmillan nurse team and the palliative care team. I'll let the Macmillan nurse know that we've spoken. Is that okay?
Yes, of course. Thank you.
And can you make another appointment to come and see me next week? Perhaps a double appointment again would be a good idea.
Yes, of course, yeah, that's fine. And by the way, thank you for taking care of my mum.
Oh, it's not a problem at all. We've got to know each other quite well, haven't we, over the years? Okay. So, take care, both of you. I'll see you next week.
Thank you, Doctor.
Okay.
Goodbye.
Okay, bye for now.
I feel a bit shell-shocked. I've talked to Dr. Kowalski about some really difficult things that have been worrying me for ages. Good to know that she'll be able to keep an eye on Jack for me. I must remember to talk to her about that next time we meet.
It's really hard to talk out loud about the final sort of end for my mum, but I see now, having done that, how necessary it is and how reassuring it is for my mum to know that what she wants to happen will be respected the way she wants it to be.
Well, that was always going to be a difficult conversation to have, and the words death and do not resuscitate are always difficult to say, but very important, so that we can hear the patient's point of view and respect their wishes. And it was also very nice that Mrs. Thomas's son was there as well. It's somehow easier if you have the support of another family member. Right, I think I need a cup of tea now.
Jack walks to the pharmacy to collect the analgesic patches that Dr. Kowalski has prescribed for his mum. He has taken his mum home as she was worn out and has come back to collect the prescription.
Hi, how can I help?
Could I pick up a prescription for my mother, please, Mrs. Thomas?
Okay, let me just go and check for it. Yeah, can I just confirm her address, please?
Sure, 63 Long Acres, Greenford.
Okay, great. Do you know if your mother pays for a prescription at all?
I think so. She's not been very well at the moment.
Okay, I'll just have a check. I mean, if you and your mother have any problems coming in to collect her medication, we can always deliver it to you. It's a free service, so just let us know if you need it.
Okay, thank you. That'd be really helpful in the future. Yeah.
Great. Now, these patches, has she used them before?
No, her pain's very bad, so the GP's prescribed these as they might work better and be stronger. How do they work?
Okay, well, they contain a fairly strong painkiller. You just need to apply one, and just remember to take the old one off first. Okay. You don't need to cut them or anything, and you just apply them just like a plaster. If your mother ever needs to have a bath or a shower, just a reminder to take the patch off that she's wearing, and to put a new one on after. I would advise just to look out for any signs or problems with her breathing. If you have any concerns, call 999. There's a leaflet inside the box you can read, which has some useful information, and again, we're always here to help if you need anything.
Thank you.
Okay, now that's for you. That'll be £8.80, please.
Great. Thank you.
Thank you.